The great isometric exercise debate for tendinopathy. Are they pain relieving? Are they not pain relieving? Should you use them in rehab? Should you not use them in rehab? Find out in this episode. An editorial was recently published in the British Journal of Sports Medicine, which looked at the use of isometric exercise on pain relief for tendinopathy. The editorial focused on answering three main questions. The first question that the editorial looked to answer was looking at the strength of evidence for using isometric exercise for tendinopathy. The original article on isometric exercise and tendinopathy was by Ebony Rio, and what her and her group did was they looked at those with patellar tendinopathy and they did an isometric contraction for 45 seconds, and what they found is that there was an immediate pain relief after the exercise had been completed. However, the editorial points out that the evidence for using isometric exercise for tendinopathy is conflicting. Another study by Seth O'Neill looked to replicate the same findings for the 45-second isometric hold for the patellar tendon in the Achilles tendon, and what his group found was that there was no meaningful difference in pain relief after the exercise. And then this is also similar in plantar fasciopathy and also lateral epicondylitis as well. The second question was whether it was beneficial to achieve acute pain relief in those with long-standing tendinopathy. The authors suggest that prioritizing acute pain relief instead of tissue capacity might misguide patients and clinicians that there's a quick fix to tendinopathy when the priority should really be on gradual loading to increase the capacity of the tendons. The third and final question that the editorial asked was whether isometric exercises are superior to other treatments when it comes to pain relief. In summary, isometric exercises were not found to be superior to other treatments such as isotonic exercises in pain relief for tendinopathy. The editorial brings up several great questions when it comes to the management of tendinopathy. For example, the editorial points out that the strength of evidence behind using isometric exercise for pain relief for tendinopathy isn't all that strong. After that original article by Ebony Rio on the patellar tendon came out, heavy isometric exercises were used for pain relief for almost everything. It was a very common exercise used, but that pain relief doesn't seem to actually be true for all tendinopathies. But when we look at some of the individualized data, some people did actually have a reduction in pain. It might not have been a large reduction, but they had some reduction in pain. While some people actually had an increase in pain after heavy isometric exercise, and then some people had no change. And so it seems that some people actually do respond to those isometric exercises when they have a tendinopathy. And so we need to kind of figure out why did some of those people actually respond to those isometric exercises. And this doesn't seem that different than any other exercise protocol that we use, whether it's the eccentric protocol or heavy slow resistance protocol. None of those protocols are actually 100% effective. Some people respond well to a heavy isometric protocol, some people respond to a eccentric protocol, and maybe some people respond to a heavy slow resistance protocol. The response seems to be highly variable, and so again, we need to figure out why do some people respond to some treatments and some people don't respond to others. I can also see the argument behind why using isometric exercises for immediate pain relief for those with tendinopathy might create a false sense of recovery in the patient and also for the clinician, and that might lead to return to sport a little bit too soon. However, I don't think this is a good reason why we shouldn't use isometric exercises in the rehab program, and I think this really comes down to patient education. And so isometric exercises can still be used as a starting place to place load on the tendon, and there might be pain relieving effects associated with these isometric exercises. And so if there's some pain relief, the patient might be a little bit more comfortable in placing load on the tendon, and it might actually increase compliance with an exercise program. And so as long as we're telling the patient that while isometric exercises are just a starting place and that there might be pain relief, we still need to build the tissue tolerance. And so we'll still need to go through isotonic exercises and plyometric exercises before returning to sport. I also think it's important to note that while the editorial found that isometric exercises were not superior to isotonic exercises for pain relief for tendinopathy, they can still be used in the rehab program. The article simply just states that we should feel comfortable that if we want to go to isotonic exercises, whether eccentric protocols or heavy slow resistance protocols, we should feel comfortable in doing that. And for some people, that might be fine. They might not need isometric exercises in their program, but for some, isometric exercises might be a good place to start, whether they're fearful of loading the tendon or it's just too irritable where they can't load it. Isometric exercises might actually be a good place for them to start. And so it really just is going to depend on the individual. Some people will be able to progress straight from isometric exercises all the way through. Some people might need a little bit more time in isometrics. And then some people might not need isometrics at all. So we really just need to tailor the rehab program to the individual. Overall, I agree with a lot of the editorial in that we as clinicians should feel comfortable prescribing a progressive loading protocol according to the individual. Some people might need isometrics, some people can progress straight into isotonics, whether it's eccentrics or heavy slow resistance. It's really going to depend on the individual's tolerance to load. And so even though isometric exercises might not have as big of a pain relieving effect or any pain relieving effect, they can still be used as a starting place for a loading progression for tendinopathy. Thank you for watching this episode on isometric exercises and their effects on pain for tendinopathy. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. And if you want to see more of my content, go ahead and hit that subscribe button as well. And to be notified of future videos, go ahead and hit the bell icon as well. I'll see you guys in the next video.